Namaste everyone. Welcome to our channel, The Tooth Doctor, and I'm Dr. Rinky Sisodia, pediatric dentist. Have you noticed a gap between the front teeth in yourself or your child? Many people call it a lucky gap, but medically we call it midline diastema. But the real question is it normal or does it need treatment? Let's understand this in a simple way. What is midline diastema? Midline diastema is a space between or gap between the two upper front teeth. In children, this gap is completely normal, especially during the mixed dentition phase, that is when both milk and permanent teeth are present. In many cases, this gap closes naturally as a permanent teeth erupt, but in some cases it may persist, and that's when we need to evaluate the cause for it. Causes of midline diastema usually are, first we talk about that's a normal growth phase, that is a ugly developing stage, common in children aged around 6 to 12 years, and usually this gets closed on its own. And second one is high label frenum attachment, that's the tissue between the upper lip and the teeth is thick or attached too low. This physically prevents the teeth from coming together. And third is missing or small teeth. If the adjacent teeth are missing or smaller in size, gaps may appear. And fourth one is a thumb sucking or oral habit. Habits like thumb sucking or tongue thrusting can push teeth apart. Genetic factors, sometimes midline diastema runs in family. And sixth one, the gum disease in adult patient like bone loss, periodontitis. It can lead to spacing between teeth. And parents often ask us, should we worry? Let me tell you, we should consult a dentist if the gap persists after permanent teeth eruption and the gap is increasing with time. There are habits like thumb sucking, you notice speech issues or aesthetic concern, early evaluation helps prevent bigger problems later. Now the most important part, how do we treat it? Treatment depends on the cause actually. First, like observation, no treatment needed. If it's in the normal growth phase, we simply monitor it. Habit correction, stop the habit like thumb sucking or tongue thrusting. And third, frenectomy, that is a small procedure to correct high frenum attachment. And fourth, in orthodontic treatment like braces or aligners, which helps the bring teeth together in a proper position. And cosmetic treatment, like in some cases we go for composite bonding or veneers, and that can close the gap. And remember, the treatment is always customized for each patient. A midline diastema is not always a problem, but ignoring the causes can lead to bigger issues later. Early dental checkup ensures proper jaw and teeth development. To better smile, aesthetics, prevention of future complication. So don't wait, get it evaluated at the right time. If you or your child has a gap between front teeth, don't panic, but don't ignore it either. Book a consultation and get the right guidance. If you find this video helpful, like, share and subscribe the Tooth Doctor. And if you have any question, drop them in the comment. I'd love to answer and help you. Until next time, healthy smiles, happy life. Thank you.